In this part, I'm going to explain what is osteoporosis. Osteoporosis is a systemic skeletal disorder characterized by compromised bone strength, influenced to an increased risk of fracture. It is a silent disease, often progressing without a symptom until a fracture occurs. Osteoporosis is a disease that weakens your bones. It makes your bones thinner and less dense they should be. People with osteoporosis are much more likely to experience broken bones or known as a bone fracture. When we talk about the osteoporosis, actually, the bones are usually dense and strong enough to support your weight and absorb most kinds of impacts. As you age, your bone naturally lose some of their density and their ability to regrow or remodel themselves. If you have osteoporosis, your bones are much more fragile than they should be and also weaker. Most people don't know they have osteoporosis until it causes them to break a bone. Osteoporosis can make your bones more likely to break, but the most commonly affected bones include the hip, wrist, and the spine.
There is 6 factors of the osteoporosis. Let's go through one by one. First is aging, because natural decline in bone density due to slower bone remodeling and reduced hormone production as we age. Second is genetics. Family history and genetic disorder can predispose individuals to lower bone density and higher risk of osteoporosis. Third is hormonal changes, particularly in postmenopausal women, which decrease estrogen level after menopause significantly increase bone resorption, leading to weaker bone, and hormone imbalance also contribute. Other than that is nutritional deficiencies. Lack of essential nutrients such as calcium, vitamin D, protein, magnesium, phosphorus, and also vitamin K can lead to decreased bone density and strength. Next is lifestyle habits such as physical inactivity. Regular physical activity strengthen the bones, while inactivity lead to bone loss and also increased risk of osteoporosis. And the last one is excessive alcohol consumption. High alcohol intake disrupts calcium balance, inhibit bone forming cell, and causes hormone imbalances, all of which weaken bones and also increase osteoporosis risk in our life.
Assalamualaikum and good day everyone. My name is MOHAMMAD FAKHRULLAH BUJANG, and for today's presentation, I will going to talk to you on the symptoms of osteoporosis. According to NIH, Osteoporosis and Bone-Related Diseases National Research Center, in their website, they mentioned that osteoporosis is a silent disease where it won't show any kind of symptoms until a fracture occurs. According to the website, there are 3 main symptoms when we are talking about osteoporosis. The first one is severe back pain, and the second one loss of height, and then the third one spine malformations. And when we are talking about spine malformations, this can be considered as what we call that stoop or hunched posture, which also known as kyphosis. So I already done with my part. I will pass my presentation to the next presenter. That's all from me. Thank you.
Hello Miss and everyone, I'm Miss Yanda Peter. Okay, I will share about the benefit of exercise to osteoporosis disease. Alright, the benefit of exercise have 3, which is the can increase bone density. The exercise can help to make bone stronger, especially for adults and even the elderly. For example, the exercise weight training, which is jogging, walking, and so on. Okay, the next benefit can improve muscle strength. Why the exercise can improve muscle strength? Because the exercise are very important to supporting the bone and protecting the bone. For example, the exercise weight training. This exercise can help to maintain muscle mass and strength. Okay, the last one benefit of exercise can improve body balance and coordination. This is a very important and very helpful for individual with osteoporosis because this can reduce risk of the fracture and fall. Okay, that's all from me. Thank you.
First, in exercise, there will be 4 key things that the osteoporosis patient need to look at. The first one is weight bearing exercise, second one is strengthen your muscles, balance exercise, and the last one is flexibility. So let's move with the first one, which is weight bearing activity. So this workout builds bone strength by making your body struggles against gravity. So for example, like walking, stair climbing, and dancing. The second one is strengthening workout for the muscles. So this movement fight against gravity, which is the same with the weight bearing activity, but this time we are using weight or our body natural as a resistance. So walking with resistance band and utilizing weight machine, lifting free weight and lifting your body are the few example for this exercise. The third one is balance exercise. So this activity help the patient to stay upright and reduce the risk of falling. The exercise that they can do is yoga and tai chi. The fourth and the last one is workout that improve flexibility. So this workout keep your joint and muscle supple. Stretching and yoga are among of them. So thank you.
Hi, my name is MOHAMMAD bin JAUHARI. Today I will present about those exercise for osteoporosis patients. For the first main point is must be avoid for osteoporosis, which is high impact sport or exercise. Sports that include hockey, football, and any high intensity that can lead to falls and serious injury for osteoporosis patients. The exercises that must be avoided by osteoporosis patients include jumping, running, or even jogging that can lead to serious fractures to the weakened bone that can lead to a broken bone for osteoporosis patients. The second part is heavy weight lifting exercise that must be avoided by osteoporosis patients. So this heavy weight lifting exercise that involve spinal compression or even slouching that can lead to injuries or maybe risk of injury of spinal fracture or even a broken spinal bone. This is for certain heavy weightlifting exercise must be referred to physical therapists for more options for heavy lifting. For the third point, which is abdominal crunches and sit-ups, must be avoided by osteoporosis patients because of spinal compression and spinal flexions that can lead to fractures or broken bones. So exercise must be referred to physical therapists before engaging abdominal crunches or even sit-ups, or maybe must be find for options for abdominal exercise. Fourth point is certain yogas and pilates. To avoid further injuries, the osteoporosis patient must be avoid from moving from yoga positions towards another positions rapidly. This is to reduce the risk of broken bone, mainly on spinal bone.
Hello, my name is ELIZDERRON VITUS. So you guys already know what is osteoporosis, the factor and the symptom of the disease, the benefits of the exercise to the disease, and the do and don'ts to the disease. So for the conclusion, it can be concluded that osteoporosis is characterized by weakening bones, which is increase the risk of fracture. So rehabilitation is essential for managing this bone disease and improving overall quality of life. So it is recommended that exercise give benefits to the disease. It also increase bone density, improve muscle strength, and improve balance and coordination. So that's all from us. Thank you for your time.